how long do prednisone side effects last? Months? Days? Years? The real question is, when am I finally going to feel better? When am I going to feel like myself again? Before I answer that question, I want to tell you the story. This is the story of Admiral Stockdale. He was a very high-ranking officer in World War II. He was a naval admiral, Admiral Stockdale. And he was captured by the Japanese. And they tortured him over 20 times. 20 times. He was in concentration camps for 8 years. It was terrible. And in this book, Good to Great, by Jim Collins, he interviewed Admiral Stockdale to understand how he could survive that much torture and come out to tell the tale. So I want to read directly from this book, just one paragraph, because it tells it way better than I ever could. He says, and they had been in these torture concentration camps for years. And he said, who didn't make it out? Who died while being tortured? Who died while under that kind of misery? And he said, oh, that's easy. The optimists. The optimists? I don't understand, I said, now completely confused. The optimists. They were the ones who said, we're going to be out by Christmas. And Christmas would come and Christmas would go. Then they'd say, we're going to be out by Easter. And Easter would come and Easter would go. And then Thanksgiving. And then it would be Christmas again. And they died of a broken heart. Another long pause, and he looked at me and he said, this is a very important lesson. You must never confuse faith that you will prevail in the end, which you can never afford to lose, with the discipline to confront the most brutal facts of your current reality, whatever they may be. And so it is with prednisone. Prednisone is its own special type of torture. Prednisone is a miracle. It saves lives. It saved mine. But it is its own special type of torture because it comes with so many side effects. And so the question is, when are you going to feel better again? How long do these prednisone side effects last? And so I usually get these questions about 3 topics. About psychiatric side effects, like when is the anxiety going to go away? When is my adrenal system going to return? And when is my moon phase or weight gain going to disappear? So there are factors that come into play. First of all, the dose. What dose you're on depends on how bad those side effects are, and it can kind of affect how long they'll last. So if you're on really super high doses of prednisone, it might last a really long time because you have to slowly get back down. Whereas if you're only at a slow, steady, low dose, your body is a lot closer to its normal cortisol levels, and it can sometimes recover faster. The other thing that matters is how long you're taking it. So if you're just taking it for 5 days, you'll probably recover pretty quickly. Some side effects do last a long time, even if only it's 5 days. Because one key thing to understand is there is no dose too low or time too short to be on prednisone for there to be no side effects. Your doctor might be saying, oh, you're only on it for 5 days, you won't have any side effects. And that's just not true. There's too much evidence showing that even one dose causes side effects. Some side effects last a really long time. Some of them are permanent and irreversible. And some of them just go away as the dose goes down. For example, moon phase. It lasts as long as you're on really high dose prednisone. And it usually goes away once you're below 10 milligrams or 5 milligrams. And for sure, when you go off prednisone, it's usually gone. But for some people, it takes longer. It's really dependent on each person. Some people, it takes a couple months after you stop taking prednisone for the moon phase to go away. Sorry. Okay. And then which ones are permanent and irreversible? Which ones just don't go away? Glaucoma, osteoporosis. Those are just some of the examples. I'll link to which ones are irreversible, but some of them never go away. Some of them are permanent. But of the three that I get asked about the most, first of all, we'll talk about mental health. Usually, the higher the dose, the more likely you are to suffer mental health side effects like anxiety, depression, paranoia, and just really not feeling like yourself at all. Because it's not you, it's the drug. You're not crazy, it's just the drug. And so, here, and I'll link to a video about that too. Usually the lower the dose, the less of that kind of a side effect you have. But sometimes it takes up to a year for that to go away, for the anxiety to go away, for the dementia to go away. Sometimes it takes that long. Usually it's really fast. Usually it's once you get off of it for most people. But for some people, it can be more drawn out. So that was the first one, was mental issues. Second is your adrenal gland. So prednisone is replacing your cortisol that tells your adrenal cortex from your right above your kidney to your brain and your hypothalamus. That signal is all being interfered with by the prednisone. And usually in most people, that signal starts to catch up and gets into place. The lower you go, the closer you get to 2.5 milligrams, the more it'll just kick in. For 90% of people, it just kicks in once you've tapered really slowly. But for some people, it doesn't kick in. For some people, it never kicks in. And that's called adrenal insufficiency. So for the 90%, when does it kick in? Usually, it's within a week or two after going down to 2.5 milligrams and then off. It's usually pretty quick that it comes back. But for 10% or maybe 1%, somewhere in that range, nobody really knows, it doesn't kick back in. And if you have adrenal insufficiency from prednisone, it can be requiring you to be on prednisone for life. I know, it's terrible. So, what to watch out for are prednisone withdrawal syndrome symptoms, like feeling like you've been run over by a bus, feeling joint pain, achy, and I've got a whole video all about more about this that I will link to as well. So that was the second one. And then 3, the moon face and the weight gain. When does that go away, right? So the moon face, the higher the dose, the rounder the face, usually. The lower the dose, usually the moon face starts to go away. And the weight gain is the same. The higher the dose, the higher the weight gain. The closer you get to normal cortisol levels, the less weight gain there is. But the real thing is, prednisone weight gain, as my doctor told me, is weight gain. It doesn't just disappear when you stop taking prednisone. It's real weight. Those are real pounds. They don't just fall off. They don't just disappear when you stop taking it. You actually have to lose the weight. Whatever you've done in the past, whatever it takes is what you need to do now to lose that weight. Whether it's a keto diet, whether it's intermittent fasting, whether it's paleo, whether it's whole foods, plant-based, whether it's 1 meal a day, whatever you have found that works for your health conditions, your diet type, whatever you know will work, do that. And that you have to lose it. So then the moon face, it usually goes away. But I hear from people who are like, I've been off prednisone for a month and it's not gone. So that's possible. It is possible. It might not just immediately go away, but it usually does. In most people, you stop taking the prednisone and within the month, it's usually gone. So of all of those things, most of prednisone goes away. Most of those side effects go away. But there's a few that are irreversible. And the one that I want you to know about the most is osteoporosis, because it's not talked about enough. Osteoporosis is when your bones are thin and brittle and they can break and make you hunch over, and you need to be taking calcium and vitamin D every day that you're on prednisone and after you take it to build back up your bone mass, because you do not want to be breaking bones when you're way too young to be doing that. You don't want to look like an old grandma before your time. So be sure to be taking calcium and vitamin D every day according to the doctor guidelines. And I created this product called Nutrinize Zone, and it has calcium and vitamin D and the other nutrients that prednisone steals. So you should check this out at nutrinize.com. I'm Dr. Megan, the Prednisone Pharmacist, signing off.